Hello everyone, I am urologist Omar Erdamakaya. The topic I will talk about today is whether it makes sense to do testosterone therapy in 35 or 40-year-old men. Friends, testosterone treatment can be done at any age. It can be 60 years old or 25 years old. The important thing is to determine whether the patient has complaints of testosterone deficiency, to determine the patient's testosterone level and to determine whether the patient will be harmed or not when using testosterone. Currently, the world trend is actually to lower the age of TRT treatment. In other words, I see that doctors in the USA are starting TRT treatment in patients aged 25 or 30. There is also some pressure from social media on doctors. Doctors also use this and actually start TRT treatment at a very early age. At the age of 25 or 30, we should first check whether there is a child plan. Of course, TRT treatment does not create permanent infertility. But it is necessary to say that it sterilizes the patient for that moment and deteriorates sperm quality. Now let me add that the expectations of the patient we start TRT are important. A significant part of those who consult me are personal trainers or coaches. These people are usually people who know themselves, who have researched this issue, who understand that they suffer from testosterone deficiency. Because these people are active both sexually and in terms of sports activities. And if you give TRT to a sedentary person, they won't understand much. I mean, if they don't have an active sexual life, if they don't have an active sports life, they may not understand much. But the people who reach me are usually people who have testosterone levels below 350, who are also active in sports, who give sports lessons to people, who are involved in social media, so they are doing many things at the same time. A few years ago I would not think to give TRT at 30 or 40 years old. So let's increase the person's own testosterone level, let's deal with it. Instead of TRT, the patient should be supported with drugs such as Proviron and Clomid. The patient already pays attention to details such as diet and sleep. Most of the people who contact me have better sleep, nutrition and quality of life than me. So they are already very meticulous. But the testosterone level is very low. In other words, it is actually low according to the patient's lifestyle. On the one hand, of course, since he is an athlete, the body has actually adapted to this. But my opinion in the last 1 year, when such patients start TRT at the age of 35 or 40, and I talk to them in the follow-up after 1 year, patient satisfaction is very high. The quality of life, the pleasure of their partner, their sports ability, their concentration in sports has completely improved. Their fatigue is gone, their malaise is gone, their vital signs are very good, their laboratory findings are very good. This is how it usually happens in men. But we should also say this. Today, testosterone therapy is still given for complaints such as loss of sex drive, erectile dysfunction, and decreased libido. In other words, TRT is not given to the patient to improve the quality of life. This fact is actually a little bit ignored. Men with low testosterone levels have higher mortality rates from all causes than men with normal testosterone levels. Or cardiological causes of death are more common in men with low testosterone levels. Low quality of life and depressed mood are more common in men with low testosterone levels. But as urology associations, we still do not give testosterone treatment to improve the patient's quality of life and well-being. Let's give an example of a patient group. He is 60 or 70 years old. He does not have a partner. In other words, the patient has nothing to do with the benefits of testosterone. Since this patient has no sexuality, we deprive this patient of treatment even if testosterone is low. We do not offer such a treatment to the patient anyway. And perhaps because the patient lives his life at a low testosterone level, all-cause mortality rates increase, cardiological mortality rates seem to be higher. Now, globally, maybe in 10 or 20 years, the indications for testosterone and the prescription of testosterone may change. But in my opinion, should TRT testosterone replacement therapy be started at the age of 35 or 40? If you have given the patient information about having children, if the patient does not have any problems during TRT, if the patient accepts these, if he has follow-ups and is knowledgeable about this issue, TRT can be given easily. And if the patient's quality of life improves, the patient can use this treatment for many years, maybe for life. It makes a lot of sense right now. I have been heavily involved in TRT for the last 10 years, and since the last 3 years, my views on TRT have started to change a little bit more due to the feedback of the patients. It started to be more positive. In general, this is the subject of TRT treatment in 35 or 40-year-old patients. Thank you for listening.